Good afternoon. My name is Scott McGann with the Falmouth Health Department, doing our weekly COVID update. Today is August 14th, 2020. The Falmouth Health Department's phone number is 495-7485. Email is health@falmouthma.gov. And the website, we have a COVID-only page at falmouthmass.us. So getting into the counts for this week, 240 cases of COVID since March 19th. Those are all positive molecular PCR tests, so the viral test results. Those are the confirmed cases. And a couple of people have asked me questions about that number. That number includes only Falmouth residents. So if someone was to get it here but was a resident elsewhere, that would not count towards our number. And the converse is true. If you happen to have someone going to college and they test positive in November, but they use Falmouth address, it would count as one of our cases. We saw that in the spring. If you're a quote-unquote snowbird and you were traveling, but you live in Falmouth, but you were spending a month or two in Florida and you picked it up in Florida, the case number would show up in Falmouth as a case. So the number is based on residency. So it's not a perfect number about what might be going on, but that question had been asked a couple times this week. Those are identified as residents of Falmouth. So 240 cases. There's been 3 confirmed cases in the last 8 or so days. One of them is actually a duplicate, would probably end up coming off. Sometimes a positive result 1 month and a positive result a few months later, they assign its separate case numbers, and then eventually fix it, and then it comes down. So we're somewhere around that 239 to 240 range. Roughly around 95% of all cases are no longer in isolation. Most of them still in the long-term care, which I'll talk about in a minute. Falmouth is about approximately 13.3% of all cases. We expect to be about 14% of all cases in the county. The maximum we were is at 23. The VNA and the CTC, which is the state's contact tracing collaborative, with the support of the health department, do the isolation and the contact tracing on each case. How we've been doing it here is the cases that are interstate, someone who's happened to be a resident of Falmouth but is in Boise, Idaho, for example, or someplace else. That's usually when you get to CTC, they have a little bit more ability to get cross-jurisdictional. The local cases generally stick more with us. So we do some sharing with the contact tracing collaborative based on a case-by-case basis. Our trend chart, this is our weekly case trend. As you can see, back in April, late March, early April, we were high. We had a spike again with the nursing homes in May. Another with the lifeguard situation, and also the nursing home around the end of July into early August, and now we're back into our 5 plus or minus cases per week. And that's sort of where we are now. Hopefully that continues. You can see the trend over the last couple of weeks has been downward, and hopefully that continues. This is since the beginning of the outbreak, again, shows the early on very fast track case number as the graph shows going up. Again, happening again in mid-May, again a couple weeks ago, and sort of flattens out after that. And hopefully it continues to flatten out as we go forward. This is the state's dashboard. This is updated daily after 4 o'clock. This is the state cases. And you can get this at the state's, the DPH is Department of Public Health. If you just type in Google search COVID-19 dashboard, this will come up and it's updated right around 4 to 5 o'clock every day. As of yesterday, it was 319 new cases. If you look, there was 27,000 tests. So normally we've been averaging around 10 to 12, 13,000 tests during the week. They're starting to count now all tests issued. If you are someone who gets tested on a weekly or twice a week or a monthly basis or whatever it happens to be because you're in an area like you work in a long-term care or you're a patient in long-term care, in different places like that, they were just not counting each one of those tests. Now they're counting every single test is what I've been told, from what I can gather on the website. So our number of tests went way up in this last dashboard. Total number of confirmed cases, 113,517. Total deaths are 8,568, with 21 deaths reported yesterday. One positive trend is if you look at the green arrow, it shows that the testing capability went to a positive trend instead of in progress. That had been previously in progress. And so we're looking at trying to get all of those metrics into a positive green trend. Now that they've added a lot more of the tests that were actually being done, you can see the percent positivity was going to go down as a result. The rates down has dropped a lot in August, and it's got something to do with maybe them adding some of those tests in. The more tests you add in, the positives were known, and if you're adding a lot of negative tests back in that were not necessarily being counted before, the percent positivity is going to go down. But it's in the right trend, and that's good. The number of patients in the hospital has been pretty stagnant to slightly up in the high 300s. Again, as a particular incident at a long-term care could cause cases to go up in a particular place. So hospitalizations could be made on a couple of different cases that have turned into big clusters, or it might just be sort of the general increase. So it's in the 350s, it was in the high 60s, and then it kind of got into the 380s. So it's not really in the great trend. It's still down, but it's not in a great sort of trend. Surge capacity is bouncing all over the place. Depends on the hospital, depends on the situations. The next one is the deaths. The deaths have been averaging in the teens. Now we're in the low to mid-teens now for basically most of the month. And those trends, again, of course, we want to just keep seeing them going down. I would say most of them are pretty flat. This is Barnstable County specific. There's 1,802 cases with 158 deaths in the Barnstable County. And you can see in that late July, early August, when we were having our increase, of course, our numbers count into this. You also see there might have been a slight increase, but you do see towards the end of August, August 1st to August 8th, that the numbers are down more towards what they were in the early July, and hopefully that trend stays into that late June, early July, where we were getting 0s, 2s, and 3s, and 4s, and we've been 2s and 4s, the last several days, the last week or so, and hopefully that trend continues, that we stay nice and flat and low. As far as testing rates in Falmouth, if you look, the chart on the right is the last week's, and this week's is the August 12th one, and it shows that we're doing a robust amount of testing. We're still doing a pretty good job with testing and testing amounts, and I'll talk that a little bit later. Total tested in the last 14 days, 1,350 tests. This is an important new metric that's out there. This is what we're going to use, and what the states have wanted us to use as far as schooling is concerned, and what phase to be in schooling, whether it would be in person, a hybrid on and off, or completely remote. White and greens are low levels of infection. Right now we're green. We could end up white if we have another good week. I mean, we're still sort of having some of those cases that were lingering over earlier in the 14-day cycle. But right now our rate is in the green, and you see several towns that are in the red up around the Boston area. And they also tie it in with this next slide here up top, where it shows that the case count was 239 Wednesday. This is done on Wednesdays. The dashboard is updated daily, but this part is updated weekly, and it's on Wednesdays, usually well after 4, just because it's a lot of data. If you look at our incident rate per 100,000 over the last 14 days is 1.6. Case count in the last 14 days is 7. We're on a lower trend. We've done 1,350 tests, a total of 8,650. And a percent positivity, if you look down below, this was the chart from last presentation. We were in that 0.5%, 3.37. We went up to 2.37 after the 2 incidences that we had, the 2 clusters, down to 1.15, and then today we were at 0.59. And so we want to keep that low, and that 0 point something is much better than having it at 2.3. The state average is 1.75, which last week was 1.82. So the percent positivity is on a downward trend. The state is on, well, at least the percent positivity, and we're doing a lot of tests. And again, the tests that they're actually counting more testing now than we'll change that a little bit. So here, that's where we're at, and that metric, this one at the top, and also the color-coded by town chart, is what the states are going to have the school, or the recommendation is to what model the school system should be following. For what I've been told is that white and green would be more in person, yellow would be more of the hybrid, and then red would be remote. But you also have to consider what caused that yellow or red or green. So if you're in the yellow, but you happen to have a prison that had 300 cases in it and you went to red, it's not really community spread. So you have to look at where the cases are. Same would be true of a long-term care. So if we had 20 cases in Falmouth, all at long-term care, is that necessarily relevant to school? So that's the state saying that you should also look at where the cases are coming from and the circumstances behind it. And so that chart, that is brand new from a couple of days ago. And so that's something we'll be watching closely, as will the schools be watching closely. As far as hospitalizations, getting back to the state chart, we're down to 419 average amount down from June 26th. up 52 from July 22nd and down 2 from August 7th. And there's trends there for hospitalizations in the state. Cape Cod Hospital and Falmouth Hospital is 0. I believe Falmouth Hospital has been 0 for at least a week now in hospitalized and ICU. That's also part of the daily COVID dashboard where you can check that on a daily basis. So that's encouraging to see. Most of the cases that we're getting are in the younger population, so that's going to make that does make sense, as we know that the hospitalizations and the ICU is generally people with comorbidities or age or elderly. So that's where we are now. And then again, Falmouth Hospital, Cape Cod Hospital have been doing quite well. ICUs, people currently in ICU is 73 yesterday. That's down 123 from mid-June, late June, down 12 from August 7th. Intubated to down 6 from August 7th, down 76 from June. And it does fluctuate, although we did go up 11. That's a lot yesterday. So that's something, again, we just keep watching on a day-to-day basis. Our long-term care, 65.6% of all deaths associated with long-term care facilities. That is almost not changed. It's been bouncing between 65 and 66 for about 3 months now, so it's a fairly consistent number. We haven't had any new cases in the nursing homes. Actually, the one that we had several weeks ago is resolving itself beautifully, and not the same impact that previous times that COVID had hit long-term care facilities in Falmouth. And so I'm really encouraged by that. That's really great news. As far as COVID testing, this is the same slide I put every week. Through a doctor's note, you can go through Cape Cod Healthcare call center. They have a test site here in Falmouth at the hospital, up in the parking lot behind the hospital, on the Terhune side. I guess you would say it's on the west end of the hospital. You'll still need an appointment, and that's done through your physician for billing, and so that's and that's only the gold standard test, which I'll talk about in a minute, but that's where you can get tested. You can also get tested at the CVS in East Falmouth, the walk-in clinics, such as the one at Convenient MD, the Community Health Center of Cape Cod and Mashpee also does it, and these are for the PCR test, which I'll talk about the different tests in a second. I like to keep the slide up, even though maybe this is a repeat from last week. There are different types of tests, and people just need to know the difference between the tests. An antibody test tells you that you were previously infected. If you were sick in February or early March and there were no tests around, and you were really sick and they couldn't figure out why, go get an antibody test. It's simple. It's very quick. It's just a prick of the finger with a little bit of blood, and it changes colors on a line on a little thing. It's almost sort of like a pregnancy test. It detects antibodies in the blood. It's rapid. It indicates a past infection, and MDP and the Mass Department of Public Health would consider that a probable, as so far is what they're doing. The antigen is the rapid result. There's some places out there. There's a place in Dennis that does it. It detects an antigen indicating a past or current infection. It's not nearly as accurate as a PCR. It's not. And so anybody who tests positive, we would recommend that they go get a PCR test after. Department of Public Health also doesn't consider that a confirmed case. Again, the 240 is confirmed number, so that would not count as a probable. It would count as a probable, not as a confirmed. So the antigen test is another test. The benefit to it is it's very rapid. When you come to the PCR, which is it detects viral DNA, it is greater than 24 hours. They're averaging, I think the state said 75% of all tests come in within 72 hours, but that's that other 25% that's taking longer. That is a little bit on the long side, and it's got to do with the labs. The labs are just at overcapacity. When you're testing 10 to 20,000 tests a day, the labs just are having trouble keeping up. But that tells you, that is the way to tell you a past or recent infection. So that is considered an active infection, or a recent one where you're still shedding the viral DNA, but it's not a functional DNA where it's not spreading at that point. That's the only way to have a confirmed case. It's just the delay is the problem. There's a delay with that. And so a lot of people have gone and get the antigen. But if you come positive with an antigen, or actually either positive or negative and you have symptoms, I really suggest you get the PCR test. Going into the phases, we're at phase 3, step 1, which began July 6th, but there's been some new guidance. Anybody who has gatherings of any type, Governor's Order 46 went out. I think went out last Friday, if I believe, on the 7th, which limits gatherings to 50 or less and encompasses more types of activities. So if you're having anything like any of these activities that may not have thought of before, that you were limited to 100, you're down to 50 now. And so I just suggest that if this affects you, you need to take a look at the gathering order, which limits gatherings to 50. Okay. There's also been some updated youth sports that are effective on the 17th. No more than 25 players or participant on a single playing surface, no more than 50 excluding players and surrounding any surrounding the surface or playing area or start and finish lines. And so if you need that, you can get that online. If you're not, you can contact us at the health department if you're a youth sports person. Guidance changes and how to decipher guidance changes is very complicated, as some guidance come in and includes, sometimes it exempts. So it's, it's quite complicated. It does change daily, and we do our best to decipher it and get it to everybody. So I don't think we're changing out of Phase 3, Step 1 anytime soon. He actually went back and went stricter on the guidance for the gatherings. So if anything, we're going to stay where we're at, or hopefully not, but we may have to at one point go to Phase 2. But I think the governor seems to want the state says Phase 3 with some changes, and it changes a lot and frequently. So if you're a business and you are part of this, you have a sector and you've printed out things a month or two ago, you should stay on top of it because the guidance does get updated quite frequently. I do our best if we have contact information for businesses that we license, we do our best to send it out, such as, recently we had the governor's travel advisory. We would send that to all hotels and rentals that we're aware of. So we do try to send it out as much as we can, but we don't know everybody and where everybody is per se, so you're responsible for your guidance. Social distancing. The main thing, again, continued diligence with social distancing and face coverings, hand washing, hand sanitizing, quarantining upon arrival from location with higher rates. Again, that started on August 1st, 14-day quarantine from most out-of-state areas. I think they added Rhode Island to that list a week or so ago. Avoid gatherings, parties, especially indoors and without social distancing. Stay at home when ill. There's a lot of symptoms of COVID and other diseases mimic it, colds, flus, things like that, but stay home when ill. Follow the state guidance, okay? And this past week, the Board of Selectmen voted mandatory face coverings at the Main Street area and in Woods Hole, which would encompass Water Street, Luscombe Ave, and Railroad Ave. Some signage is pending. It's not really, the enforceability of it, it's a little difficult. It's kind of hard to run down there and check on somebody who's moving around, but it is a mandatory place, and there will be some signage on it, and we just hope and expect everybody to follow that. And part of the rationale is people are walking in and out of the places really quick, so if you don't have your mask on, you think you're 6 feet away, and we have a lot of doors here on Main Street in Woods Hole, and plus the walkway itself isn't really that wide, so it's hard to maintain good social distancing. So there was a request to the Board of Selectmen, and the Board of Selectmen agreed. As far as the health department's concerned, we do daily complaint follow-up regarding social distancing and face masks, especially on interior businesses. And we do it as you complain. We'll go out there. Even if you may not get a response, you might just drop us an email or a voicemail. We put it on our list, and we go out and follow up. Again, of course, the last thing we want to do is to undo the hard work that's been done. And we want to keep things, especially as school opens, we want to keep our counts really low so that we can allow a safe return to school. So, again, as a recap, state metrics were on a slightly increase to somewhat flat. Data was still being analyzed to determine if if this is what's expected for Phase 3. They did revise the gatherings down to 50, for example. Falmouth and Cape cases remain low. We are in the green category over the last 14 days. If we have another good week, we probably will end up in the white. And again, our current level in Massachusetts is Phase 3, Step 1. So that's what I have for the week, and I will do this again next Friday. And any direct questions, just contact us at the Health Department. Thank you.